And he said to me, you're going to have your thyroid removed. You haven't got any choice. There's nothing in the world that can help you. Nothing.
We have to educate ourselves. We have to know what we're up against. And we have to learn a lot of things that, as an average person may be hard to comprehend.
You must go and do your own research and reading. Don't just take what a doctor says to you. That sounds terrible to say that, but it's the truth. If I'd listened to what these so-called experts in the UK had told me, I would have no thyroid. And I've had to go off and find out for myself and do all the legwork and all the cost to save my thyroid.
Welcome to Save Your Thyroid, a podcast all about thyroid nodules. My name is Jennifer Holcomb, and I advocate for fellow patients suffering with this very common condition. Thyroid nodules impact 70% of adults in their lifetime, and the standard of care is surgical removal of half or all of the gland. But in recent years, safe and effective non-surgical treatment options have become available. In this podcast, I sit down with patients and physicians to discuss life with thyroid nodules, treatment options, and how to save the thyroid whenever possible. Welcome back, everyone. I'm so excited to introduce to you today a new guest who's been a member of the Save Your Thyroid community for a number of years, actually since the very beginning, a little over 4 years ago. And she's the first patient in our community to undergo a procedure called thyroid arterial embolization, which is a procedure, it's a non-surgical procedure used to treat very, very large thyroid nodules and sometimes thyroid nodules that are overproducing hormones. And since she had that procedure in early 2020, she's been very passionate about sharing her experience with other members of our community who are experiencing a similar situation that she has. She used to have a very, very large thyroid, and now she doesn't. So, Kathy, welcome to the podcast. I'm so glad to have you on today.
Thank you. Nice to meet you, Jen.
It's so nice to meet you. We've been talking for 4 years now on the Facebook community, and seeing seeing your photos there and everything, it just hasn't told the whole story. So I can't wait to hear the entire story today from you directly. So let's just start off with, you had this massive thyroid, you were offered surgery. You didn't want surgery.
No. So I'd had nodules for a number of years, and they'd obviously grown over that time. I tried a lot of things with diet and stuff like that to sort of reduce them. I didn't really have much success, although I kept myself very healthy in the process. And I think I had them for about 15 years. So they've got really, really big. They were absolutely enormous, both sides. And it was, roughly about 4 years ago, I went and had a scan, and they said to me, you've got to the point where your windpipe is starting to get affected, and you're going to have a complete, total thyroid, TT, total thyroidectomy. And that's that. So I've never been one for kind of towing the line with, especially from the medical profession. So I always go off and do my own research and reading. So, because I'd had health problems in the past and got better through alternative medicine, and I hadn't, if I'd listened again to the NHS here, I probably wouldn't even be here. So I just thought, well, I'll just do what I do. So I went off and started reading, trying to find alternative ways to treat thyroid nodules. That's how I started searching on Google, and I didn't really find a great deal, I have to say. And then I started going through PubMed and some of the, I think, is it NCBI? I think some of the medical papers. Anyway, I was reading late of a night, plowing through all these papers, and I stumbled across, I think it was an American doctor, and she said she treated thyroid nodules in a patient with, some vitamins and supplements. And then she said, and RFA. And I'd never, ever heard of RFA. And bearing in mind, I'd seen numerous endocrinologists in the UK and very good alternative health practitioners. No one had ever spoken to me about RFA. I'd never heard of it. I had that sort of kicking around in the back of my mind. And a couple of days later, I thought, I must look into this RFA. So I started reading about it, and I found the doctor in Turkey who I ended up actually going to. I found his website, and I think that was from a search for non-surgical procedures for thyroid nodules, something like that. I typed in and found him. saw his case studies, and I also noted the embolization technique on really big nodules. Anyway, so I just thought, no, RFA will be for me. I thought that's what I want. It sounds really safe. I've now got to find somebody. So at that time, Dr. Morley was in Harley Street, and he was the only doctor in the UK that was offering RFA.
Right.
So it was about just over 4 years ago. So it was in the October of 4 years ago. So anyway, I went trotting up to London because I live in Cornwall, miles away. I went up there and I thought, right, this is my answer. He's going to sort it out. I don't have to go through surgery. So anyway, he did an ultrasound and he said, I'm so sorry, but he said, they're so bad and they're so enormous that RFA wouldn't work for you. He said, I could have a go, but he said, I think I would just kill your thyroid off. And he said, and he was quite new to RFA as well. He hasn't, to this day, I mean, he's not doing it anymore, but he hadn't actually worked with that many patients. So I think he was quite cautious in the size of the nodules and the amount that I had. And he said to me, you're going to have your thyroid removed. You haven't got any choice. So I was really gutted. I just thought, I don't believe this, because I thought I'd found my way out. And I said, okay. So at that point, I thought, I've got to have this done. And I said to him, okay, do you know any good surgeons? And he said, yeah, there's this guy at the Cromwell. He's one of the best thyroid doctors in the world. He teaches, etc., etc. So I paid out, went and saw him, had a consultation with him. And he said to me, I mean, it's unbelievable, really, when I think about it now. He said, there's nothing in the world that can help you. Nothing. There's no procedure in the world. So arrogant. So he said, there's nothing available. You've got to have your thyroid removed. And unfortunately, because the nodules had got so big, I was in the higher risk category for things going wrong. So voice loss or damage, parathyroid damage. So I came out of there with my head spinning, thinking, when he told me that I was in a higher risk group, and I just thought, I don't want to go through this. I don't want to lose, the risk of losing my voice because of my work. And it's just, and I'm one for chatting a lot. It would have really affected me. So I just thought, right. So I went back to the drawing boards. So I went and started searching again, and then went back to the site that I'd seen from the Turkish doctor, Professor Saim Yilmaz, found the embolization page. And I thought, well, there are case studies on there with people with, like they look like they had two heads, huge goiters, worse than mine. And he'd reduced those. So anyway, I emailed him and said what had happened. And then he came back to me and he said, look, send me photos and all your scan results and your bloods. And he said, and then he came back. So I did all that, got all that together. And at that time, COVID was starting to rear its head, abroad. So that was bubbling along as well. This was all, being reported in China that there was this virus out there, et cetera, et cetera. So anyway, so that was in the background. So he then came back to me in the new year in 2020, and he said, I think you would be a good candidate for embolization. But there's so little known about embolization. I think there'd been one study done, and that was it. And it said it was effective, but I was going out there really with I didn't know anybody. I mean, I put it out there, even on the Facebook, I said, has anybody had embolization done? I didn't know what to do. Anyway, I've got two very good practitioners, functional medicine practitioners, that have looked after my health for many years and helped me. And I said to them, what do you think? And they weren't that sure. They were worried it would just kill my thyroid. And I think they thought I was clutching at straws, to be honest. So anyway, I then spoke to Saim on the phone. I mean, he's an amazing doctor, by the way, and I didn't realise he's actually quite famous in Turkey. So he had me quizzing him. He must have thought, he was really patient. He must have thought, bloody cheek, So anyway, then my practitioners arranged a 3-way Zoom call with him. And then they came off and said to me, look, he's explained how this procedure works. We think, give it a go if you want to. So he went through exactly what I was going to go through, and it's not for the faint-hearted. This is very different to RFA. So by the time they'd all got together, it was February 2020, right? So there's all this stuff on the news, and I booked to go in March, and I actually had to book a week earlier because I've got cats here, and the lady that looks after my cats, the week that I wanted, the week after, she couldn't do. Anyway, it was really meant to be because that's when we were in lockdown. So anyway, I went out in early March, and I got back 4 days before lockdown. So I went I took a chance. Everyone was saying to me, don't go, you're mad, just have a thyroidectomy. You're going to come back in a body bag. You won't get home. You're going to be ill out there. You won't get back because of all the restrictions that are coming. And the government in the UK is so inept. I just thought, I've got time to do this. So I knew by the time they were going to do anything, I'd get back. And sure enough, the angels were on my side and I got home just in the nick of time.
Wow. That's amazing. So that happened in you said March
2020.
Yeah. Oh my goodness. So that's the same time I had my second RFA procedure, and it was the same. It's not related to your story, but it's so crazy because that's the same thing. We were like, oh my gosh, like we were there. I had to travel to get my procedure, and my kids their school shutting down, and my parents are like calling me and telling me the kids aren't going back to school and how are you going to get your procedure? And I had my procedure done the last day before they stopped doing anymore.
When I was in Turkey, they were closing schools.
Oh,
so
wow.
I just got back. And when I got back, flew back into Stansted Airport, it was deserted, absolutely deserted, because they were starting to stop all the flights.
Wow. So you just got it in the nick of time. That's amazing. Thanks so much for watching this episode. I hope you're enjoying it. You know, this podcast requires a lot of my time, effort, and resources, but it is a labor of love. If you'd like to directly support my work here, you can do so in 2 different ways. You can purchase products from one of my affiliate brands, or if you would prefer to make a donation directly to the podcast, you can do that as well. Links to do either are located in the description below. Every dollar contributed goes right back into this podcast. Additionally, if you'd like to support the Save Your Thyroid patient advocacy community, which is working toward becoming a nonprofit organization, you can donate via our fiscal sponsor, THYCA, Thyroid Cancer Survivors Association. Simply visit thyca.org, click donate, and designate your gift for SYT. To learn more about us and the work we do, please visit saveyourthyroid.org. If you have any questions about any of this, don't hesitate to email me at saveyourthyroid@gmail.com. Any way you choose to support the podcast or the SYT community is sincerely appreciated. Your generous contribution keeps this work going and helps us to help more patients like me and you. Thank you so much for watching, and now back to the podcast. Take me through the process when you actually went and had it done. What was the procedure like, step by step?
Right. Okay, so when you go out there, Professor Saim Yilmaz has got an amazing clinic. He's really well known out there. He's a very pioneering doctor. So he also does RFA, and he also does something called cryoablation, which I don't know a huge amount, but that's for cancerous nodules, I think. And he does other things as well. So I'd read about him and I knew he was very good. I didn't quite realize when I got there how he was that well known. And he's a really amazing guy to work with. So his clinic is fantastic. And I just assumed I'd have the embolization done there. No, this is a much bigger procedure than RFA. So you go into hospital. So I was in a hospital in Turkey, and obviously, you know, it's not like being in a private hospital in the UK or in how it would be in the States. It's very different. So the procedure is, it would be better actually to get a doctor on to explain this in more detail how it actually works. But what they do is you have a huge amount of sedation to the point where you kind of know what's going on, but you're really zonked. So it's not a general anesthetic, but it's near that, because it is, you know. And then what happens is it's like an angiography. So I have heard, because there's more doctors now doing embolization, some of them go through the wrist. He went through my groin. Okay. So what they go through the groin and go up, and then they cut, or they get rid of all the kind of the blood supply to the nodules. So one would think, well, how do you not kill your thyroid off? But anyway, there is a way that it works. So they cut the blood supply to the nodules. The nodules, you have rapid shrinkage over 6 months, especially in the first couple of months. And then your thyroid is left intact. That's how it works. So the procedure took I was out for about an hour and a half, because it's a very precise procedure. It's probably a heart surgeon would be good at doing something like this. And you have a heavy duty amount of drugs. You're pumped full of contrast dye. You have to have antibiotics, all these things that I didn't really want to be put through, but I had to save my thyroid. So that's how the procedure works. And then when you get taken up, You also, when I first arrived, he obviously did ultrasound on me, and he did a biopsy just to check they were completely benign, because I hadn't had a biopsy till then. Didn't want that, so he did all that for me. And then you kind of go up and you're in a hospital ward, and he likes you to be in hospital for a few days after. And I mean, the pain after embolization is pretty severe.
Really?
It's much worse, I would imagine, than RFA. I mean, you're on, narcotics for about 5 days to 7 days. So it's a tough procedure. And you have to have a huge weight on your groin for about 5 hours afterwards. And that's to stop, obviously, a hemorrhage and things like that. But he's brilliant, and I kind of trusted him. I mean, some of the language barrier was a bit of an issue really with some of the nurses, but he spoke perfect English, and my mum came with me. If anyone is watching this and they want to go and do it, you must have somebody with you. That's what I would say. It's not like, I mean, I'm assuming a lot of people go off and have RFA on their own, but with embolization, it's a much bigger procedure.
Right. It's a hospital-based procedure, from what I understand. And I actually just recently interviewed a doctor about this. And so anyone who's watching this who wants to know more of the specifics about how the procedure works, they can go watch that interview. It's Dr. Juan Camacho, who's based out of Sarasota, Florida, and he goes into more of the specific things. But you did a really great job of just kind of giving a bird's eye view of your experience. And of course, it's going to be different from one hospital to another, one doctor to another. But what you were saying about what they go in with the contrast, and they isolate all of these feeding vessels that supply blood to the thyroid and the thyroid nodules that are overly enlarged. And by stopping that, they, as you said, they dramatically reduce in size. Let's go back. We were talking through the procedure, and you said the procedure was a little bit difficult and you had to stay in the hospital, and you had some pain afterward. Was it pain in your neck, or pain from the insertion of the probe into your groin, or where were you experiencing the pain?
Well, I think because I had some other health issues, I haven't got a brilliant, to be honest. I've had chronic fatigue and chemical sensitivity. I'm a lot better from that now, but I haven't got the strongest constitution. I think if you were in really good health and you just had thyroid nodules, you'd get, well, I've known, because one girl I've helped go through this from Edinburgh, she's been out there and she was in her 30s in brilliant health, and she sailed through it. She just had the pain. So it's in the neck. It's really bad. You can't have embolization, from what I can gather, without pain. That's how the procedure works, unfortunately. So because you have a rapid reduction, you also have to go on some medication for 3 weeks, because your thyroid does go into overdrive for 3 weeks. And that's again part of the procedure, but that was monitored very well, and I actually only had to be on it for 10 days. So I just kind of, and then I was sort of out of the woods really. But yeah, because of my liver's not brilliant, the contrast dye coming out and all the, detoxification of all the painkillers and drugs, that's what I struggled with as well. But if someone was in robust health, that wouldn't really be an issue for them. So, I mean, if I can get through it, anybody can really.
Wow. So after you had the procedure done, you went home, and how long was it before you saw this rapid reduction that you were speaking of?
Oh, it's incredible. The shrinkage is incredible. I mean, even in the first few weeks, I couldn't believe it. And then after 3 months, it was just, you wouldn't, what you can see now, you wouldn't even have known that I had a problem. And my friends and family were absolutely gobsmacked. Also, because we'd gone into lockdown, a lot of people didn't see me until after 3 to 6 months. So
wow.
So they didn't actually see the slow, it's not a slow, it's a rapid shrinkage, but they didn't actually see the shrinkage on a day-to-day basis. So they couldn't believe it. I had so many people stunned, absolutely stunned, because the last time they see me, I had a huge goiter, and then the next time a normal, regular looking neck.
Wow, that's incredible. Were you doing any like measuring of your neck or anything to kind of keep track of it, or were you just looking in the mirror and saying, oh my gosh, look at the change?
Well, you can just, it's from sight really. But the other point is, it took ages for my brain to adjust to it, because when I used to wake up in the morning, because there's this huge goiter, and when it all went, my brain, it wasn't really there still. So I used to wake up and it felt so strange that I didn't have these huge nodules. They just disappeared, and that took ages for adjusting to that. So, and also as well, I thought I was going to get a really wrinkly, odd looking neck, because I'd had such an expanse, and it's nothing. I've not had that at all. And I know if you have a thyroidectomy, you have a horrible scar and all kind of awful looking neck. So I didn't, not that I'm bothered about a cosmetic appearance, but even that, that's the other thing that's baffled me. I thought I'd have a really, really wrinkly neck, and not at all.
That's amazing. Yeah, your neck looks incredible. And you
Yeah.
would never know from looking at you that your neck was just huge.
Yeah.
And I felt so bad for you when you first joined the community and I saw your pictures, because I thought she's got to be in absolute misery. Were you feeling, you said that your trachea was narrowed. Were you feeling pressure on your neck? Were you having issues swallowing?
Not too much, really. It wasn't too bad because I'd had other health problems. To be honest, that was the least of my worries, really. So it wasn't really a big deal. The only slight symptoms when I had my bloods done before I went for the procedure, they were okay, apart from I had a low TSH. So I was what they consider subclinical hypothyroidism, and that would have got worse if I'd left it. But I didn't have huge symptoms, just a few palpitations. And I wasn't sure at the time if that was kind of worry from everything I had coming up as well. So I wasn't quite 100% certain. But 6 months after the procedure, I had my bloods done all completely plumb line. So the low TSH had corrected.
Oh my goodness. So you have no issues with your thyroid function at all. Everything's perfect.
I've never been on any medication, and certainly not now. So.
Oh, that's fantastic. See, that was the one part of this procedure that I really wasn't sure about until I interviewed Dr. Camacho. I was thinking, well, does that mean that once the blood supply is stopped to the thyroid, is the thyroid going to just shrivel up and die? Because I know the part where you mentioned about the thyroid overacting slightly afterwards, that's actually because part of the thyroid has died. And so that thyroid hormone that's stored within the gland, as it's being released, as the thyroid gland is dying, that's why you have that little bit of.
It's just for a few weeks. I don't really,
temporary.
I don't fully understand how it works. I've read up on it, obviously, and I read before I went, but I'm not completely 100% certain. I just know that it's worked, and I know it's worked for a lot of quite a few other people. But it is fascinating how it doesn't kill your thyroid off. I know, because you would assume, because my nodules have grown right through as well. That's what's so bizarre. But it's a very successful procedure.
That's amazing. In the time since that you've had this procedure, have you been continuously following up with someone locally, or have you had to go back to Turkey to see Dr. Is it Yilmaz? Is that how you pronounce it?
It's Dr. Saim Yilmaz. After, because of all the lockdowns, it was about 9 months before I could go and get a scan. And I went to Dr. Morley in Harley Street because I thought, he's, out of all the doctors, because he brought RFA to the UK, he'll be interested. I mean, I did contact my local GP and said, I've had this done. It's been a huge success. Can I go to the local hospital? Because really they ought to see and learn,
Right.
Instead of taking people's thyroids out, why not learn about this?
Exactly.
And he sent off a note to them, and they weren't remotely interested. They said, go back to Turkey if you want a scan.
Oh, wow.
Couldn't travel at that point anyway. So I just thought, right, okay. So I went privately and went to Dr. Morley, and he was very enthusiastic, obviously. I mean, he was stunned because he'd never heard of embolization. But he's a lot more open-minded. So he said you only see something like this once or twice in your career, something, a new procedure like this. So he was really amazed. And he's recommended me to a few other patients that had gone to him who had huge goiters as well. So it's been quite useful. And also from your group, I've recommended, I think there's been about a dozen now that I've spoken to on Messenger, or they've contacted me and said, would you mind if I ask you some questions? And I've, talked them through it, because I said, yeah, that's fine. So,
yeah. And it's amazing because, up until just this year, I mean, we've been 4 years now. I've not known anyone else who's had this done but you. And I thought it was so great that you were in the community and you were able to be a voice for those patients. And I think that the number of patients that are going to be seeking this is going to be going up, because we're starting to see doctors are wanting to be a little more particular about who they treat with RFA or thermal ablation, who have these really large nodules, because one of the possibilities of a very, very large nodule being, if you're over treating it, is that it could rupture.
Yes.
And I'm not sure if you've seen some of the patients in the community. We've had a handful of patients who've experienced thyroid nodule rupture. It's not a pretty sight.
Yeah.
They develop this huge pus filled, it's not infected, it looks infected, but
Yeah.
It's the material inside of the contents of the nodule liquefies and it's dead, and it, once it ruptures, it comes out of the skin, and so it looks like they have this giant pus filled sore on their neck. Until that resolves, they have to deal with pain and inflammation and the unsightly nature of it. And so because I think some doctors are starting to realize that these larger nodules are more prone to that, even though it's a very, very rare but serious complication. Some doctors are saying, well, let's maybe shy away from doing these very, very large nodules. Well, then what other option, unfortunately, for those patients is there but surgery?
Yeah.
And now we have just a small, I think two or three doctors in the US who are treating with embolization, and your doctor who's in Turkey. And then I think there might be a doctor in Germany, and I don't know, that doesn't mean they aren't out there, but I don't really know of any other doctors who are doing this. So this is still a very, very new, I say new, not in the sense that it's a new procedure, but new to us in the world of thyroid nodule treatment and availability.
Yes.
So it's amazing that you had your nodules treated and they shrink so amazingly, and now you're giving back to the community by sharing your experience. So this is just incredible.
It's a pretty safe procedure, but maybe it was a bigger nodule. This is the thing, and I think with embolization, yes, it's much nastier to go through, but it does guarantee shrinkage. You can't, you get some cases of RFA where people say it's the odd one where it just doesn't seem to work for some reason. They don't get a great deal of shrinkage. I don't really know why, but I know with embolization, you definitely get results. There's no ifs, buts, but it's just a horrible thing to go through. The other thing as well is all the dozen people I've helped, I've said to them all, could you please do a case, put it on the group? They all just go off into the distance because it's been so traumatic for them. They don't want to kind of put it out there and relive it. And I said, well, you need to help other people. If I hadn't put my story on, they couldn't have come to me. But it's really strange. A lot of people won't go down that road. I don't know if they think they'll be contacted too much, but you've got to help other people.
Right. I don't know if it's always difficult to go through or not. The two patients, when I did the video with Dr. Camacho a month or so ago, we had two patients come on and share their experiences. And they said it was easier for them. They had both undergone RFA previously, like you were saying, and the RFA, just for whatever reason, it didn't work for them.
Yeah.
I think partially because they had a really large substernal part of their thyroid nodule that wasn't even reachable. And so they had the RFA without sedation, so they were awake the whole time and it was very uncomfortable. Then they had the embolization and they said it was perfectly comfortable because I was sedated.
Yeah.
So I don't know if maybe it's and also this particular doctor did it through the wrist.
Yes, this is what I've heard. It might be easier that way.
I don't know. It's interesting to hear the different, techniques and how different experiences are, but I think it also depends, like you were saying, you feel like you don't have the strongest constitution. And I know we have patients in the community who say their RFA was a breeze, and other patients who say, oh, well, I'll never do it again. I'm glad I had it done, but I'll never do it again. So everyone's different. So you've had your procedure, you've had these amazing results, but now you still have one thyroid nodule that needs to be treated. Was it not affected by the embolization?
So he just did 3 of the areas. They were the most problematic, and there's it's got a bit bigger. There's a nodule there, and he just said it would have been a bit too much to have done all of that in one go. I do know people who've gone out to him since me and have had everything sorted in one go, but mine was particularly bad. So he said you can have that done at a later date with RFA, or possibly, embolization. I'm hoping I don't have to have embolization again and that I can have RFA, and we'll see. But I was going to go to Dr. Morley, but obviously he's no longer in practice. So I will probably go back to Turkey, and now traveling's a lot easier. I'll probably, and also finances, to be honest, as well, because with the whole COVID thing, my business went down the drain pretty much for 2 years. So I've not had the money. So now I'm back working a lot more. I've actually got some funds where I can go and get this done. So that's been the other factor as well, is finances.
Right. Yeah, that's a barrier, unfortunately, for all of us.
Yeah,
And
so in the UK, the
yeah.
NHS, if they don't, they don't do. I think the Royal Berkshire Hospital does some RFA, but I would personally prefer to go privately with someone who's massively experienced. That's what I'm after. So I will I think I'll go back to Turkey, and also it would be nice to go back there because he's in Antalya, and it's a very nice. People go there on holiday, and unfortunately, I've got memories of it being, going into hospital. So he said, come back and have a holiday and
Mhm.
have your last bit done. He said, and actually enjoy the place rather than being there, because the food out there is incredible. And I wasn't
Mhm.
well enough to really, eat any of it. So it would be nice to go back and have a more positive experience.
Right, right. Yeah. And I think that is one of the best things about RFA or any of these, thermal procedures that are localized is the fact that it's not, unfortunately, what you went through was a bit more of a, almost like a surgery where you have to be admitted to the hospital and stay overnight and you have all the medications in your system. But with these other procedures, it's way more likely you're going to have an easier experience. You're going to be able to do a little bit of sightseeing if you are traveling for a procedure, which, you might as well make the most of it and try to enjoy yourself if you can. So, when do you think you're going to be doing that? Do you have a timeline in your mind?
I've just had a scan actually, so I insisted locally that they were going. I'm not paying out for another one, so I insisted. And funnily enough, I went back to the hospital that just over 4 years ago. It was the same woman who scanned me. She was the one who told me I had to have a thyroidectomy.
Oh, wow.
So she couldn't believe it. I mean, she was so embarrassed. She didn't know what to say. So I just said, look, you need to go and do a load more research and learning. I said, you're sending people off to have thyroids removed when it's unnecessary. So I don't know. We'll see. But anyway, so I've got she just said there's one benign nodule that left. And I'm waiting for the scans, and then I'll send them off to Professor Saim Yilmaz in Turkey and then say to him, what do you think? And I'll probably go spring next year, I would have thought. I think I'll go. Then there's no huge rush. So I'll see.
Would you tell me a little bit about him? I don't know anything about him, and I've only, I think, heard about him through you. There might be a couple of other patients who've mentioned him in the community, but
well, I really like him. He's very easy to talk to. He's very experienced. He's pioneering, forward thinking. I mean, when I went to him, he was the only doctor in the world that did embolization on thyroid nodules. At that time, there was nobody else. And he also treats, he uses embolization for uterine fibroids and I think he uses some of his techniques for certain liver cancers as well. Whereas here in the UK, if you got this type of cancer, you just be told to go away and die. And he's got something I've read about. He'd saved some woman's life in the UK. So he's got a very good reputation in Turkey and around the world. He's vastly experienced. He's written a lot of papers. He's got a very professional clinic and very good setup. He's fluent in English. He's fluent in German, and he's a very, very nice man to deal with. Very patient. And he also, what I liked about him as well is he knew that I had some other health issues that were going to that we had to slightly change things with the aftercare. Things like having to have a catheter. There's no way I could have gone through that. So he worked around it. Whereas in the UK, you just be told tough, you've got to have this. And it actually listens to you. So that's what I really liked about him. He's very good. I mean, I'm trying to think, he was 57, so he'd be about 61 now. So I don't know how much longer he'll carry on as a surgeon and doing these procedures, but he's got a very good setup. I'm hoping he's training other people whilst
that was my next question is, do you
I hope so.
training?
Yeah, I'm hoping he is, because he needs to pass on his knowledge. But there hasn't been, I mean, I think I was the 64th person since 2013 he'd done thyroid embolization with. So he's still, he's done more since, but it's still a fairly, it's not a common procedure at all. And I think most people, when their nodules do get big, they just have their thyroid removed. So you wouldn't really, or nowadays, if you had smaller nodules, a lot of people would have RFA. So there probably aren't that many candidates for it. So I think that's probably why, and people just didn't know about it as well. But it's a not talked about procedure at all. So few people know about it.
Yeah. Well, that's why I wanted to talk to you, because I just thought it's important that people who have this type of suffering, I've seen the pictures of the people who their neck and their chin just kind of make a giant solid shape. There is no neck essentially. And fortunately for you, you didn't have a terrible amount of difficulty with your breathing and swallowing, but some of those patients, they're in misery. And if for whatever reason they don't want or can't have surgery, then they just have to live with that. And that's no life.
No, I know. There
That.
was a woman recently, the one from Scotland, who I kind of coached through. I think Dr. Morley had given her my number, and she just had she just had this huge kind of, goiter lump at the front. Mine was sort of all over the place, but hers was, and it was just ruining her life because she was conscious of her appearance, and it was worrying her. She had children, and it's just transformed her life having it sorted out, and she just wants to get on with her life and forget it ever happened, really.
I would love to know, what was the driving reason for you that you wanted to save your thyroid?
I was so worried about losing my voice, and also I didn't want to be on thyroxine forever and a day, and it would be a really high dose, because the way things are going in the world, we've got so much uncertainty and wars and problems, and I don't like being at the mercy of pharmaceuticals. I never have had, and I didn't want to be put in that position where, because if you don't, if you're on thyroxine and you say, for instance, there was a war or a problem and you couldn't get your supply, you're dead within a few days. So I didn't want to be in that awful position of being on a drug for however long I had left. And also as well, the thyroid is a really important special organ. It does so many amazing things. And I remember I was talking to, I can't remember who it was, I think it was a doctor I spoke to about this, and he made a really good point. And he said, if you have a really busy day, the thyroid is so clever, it will produce the amount of hormones to support that busy day. If you have a really relaxed day, it will do less because you're resting. And if you're on thyroxine and this huge amount, that's just the same dose every day. So I've known people who've had thyroids removed, and I think it's changed their personality as well. They've become quite miserable. So it's a very sacred organ. I think that's my view on it. And there was no way I was going to have that taken out if I didn't have to. The other point is, in my family, unfortunately, on both sides, I had a genetic test done on my thyroid, and I've got a lot of aunties who've got thyroid problems and a cousin who's got Graves' disease. So it's massively in the family. My mum's fine, but, on both sides, there's been huge amounts of thyroid problems. So I just wanted to save my thyroid, really, and not go through, because I didn't, after seeing my relatives who've been put on thyroxine, or the horrendous drugs for Graves' disease and all the symptoms of that, with the poppy eyes and other problems, I'd much rather not go through that.
Oh yes, definitely. It can be so costly in terms of your quality of life to lose the thyroid or to have a dysfunctional thyroid, and you've seen that firsthand with your family. And it can just really, really make a huge difference if you can preserve your thyroid gland. The doctor that said that to you about the thyroid functioning differently according to your, how busy you are, he's exactly right. It functions differently according to the seasons.
Yeah.
More so in certain times of year than others. And depending on your if you're female and you've got female hormones, your female hormones impact your thyroid function. It affects your heart function. It affects so many things. And as you said, the pill cannot adequately substitute for what your God-given gland is going to do for you. So you're exactly right. Yeah. And I just wanted to hear straight from you what your motivation was, because it seems so similar for so many of us who've gone through, the possibility of losing our thyroid. We all have come to this place of realization of, I need this gland. There's a reason that God put it there. I don't want it to be taken out. So thank you for sharing that.
Well, you're welcome.
So we've covered, I think, about everything. Is there anything else you'd like to share, Kathy, about your experience, or, about sharing this with the world, about educating people about thyroid embolization?
What I would say to anyone listening to this is, you must go and do your own research and reading. Don't just take what a doctor says to you. That sounds terrible to say that, but it's the truth. If I'd listened to what these so-called experts in the UK had told me, I would have no thyroid. So, I mean, I think it's outrageous that a layperson had to go off and do this. And you know, to me, it's medical negligence, actually. I think it's outrageous that they're getting paid a lot of money, far more than I earn. And I've had to go off and find out for myself and do all the legwork and all the cost to save my thyroid. I think it's despicable, actually. I think it's an appalling situation to be in. It really is. You just, as you know, if any of these doctors that I've seen who've seen me, who told me to have a thyroidectomy, if I'd done that to somebody and then I had somebody come in and say, actually, this, I would resign. I wouldn't be able to sleep overnight because I would think I've failed so many people.
It's incredible how difficult it can be to advocate for yourself, as you were saying, as a layperson who does not have the medical training in the background and the understanding of all of the terms and you know, how the system works and everything. And so that's one thing about doing this for the past 4.5 years or so that has been very eye-opening, is to learn all of these things and to understand them, at least to a greater degree than I did before. I'm not by any means a doctor, nor do I claim to be one, but I've understood things differently since going through this than I think I ever could have in the past. And it takes a lot of effort, as you were saying, to do that legwork and to do that research and to advocate for yourself. But what I'm finding is that it's incredibly important, more than ever now, to do that, because like you were saying, if you just take the first opinion that you're given as at face value, take it and run with it, that you could be making a huge mistake. That's not to say there's not value in getting opinions. That's not to say that every doctor you talk to is going to be, you know, wrong. Obviously, you know, you found the right one, but you have to also know your gut, and like you were saying, when you sleep at night, that you've made the right decision. And the only way to do that is to really understand the information for yourself and to not just put all of your trust in someone else, is what I'm saying. So so unfortunately, that's what we have to do. We have to educate ourselves. We have to know what we're up against, and we have to learn a lot of things that, you know, as an average person may be hard to comprehend. But that's why I created the Save Your Thyroid community, because there wasn't information out there. You know, you were finding this information on your own. I was finding this information on my own. And I thought, there surely must be other people out there who need this. So I can't thank you enough for sharing your story and for sharing your experience. And because even in the world of non-surgical alternatives, this is a very, very, the world of non-surgical alternatives for thyroid nodules is a small niche.
Yeah.
And the niche within that niche of what we're talking about today is even smaller, but it's so important because it impacts so many people. For any viewers who are watching this and want to learn more about thyroid arterial embolization, be sure to watch the next video coming up, which is the interview I mentioned earlier with Dr. Juan Camacho. Thanks so much for listening. Please share this content and help others. If you need resources, testimonials, and support, please join our patient community, Save Your Thyroid. You can also find me on social media and Substack under the media handle, It's Me, Jen Again. Never forget to educate yourself and be your own advocate and save your thyroid.